Hi, this is Dr. Brian Walsh, and this is Fat Is Not Your Fault program video number 4, the top 10 reasons why you aren't losing weight, specifically about hormone balance in women. Now, the first and most important thing I need to say is that hormonal issues are about balance and not about hormone replacement therapy. Unfortunately, this is something that's very utilized in even alternative medicine nowadays, but especially in conventional medicine, that women have some type of hormonal symptoms, and everybody pretty much knows that what those symptoms are. They go into the doctor, maybe they're tested, maybe not, and then often are prescribed, in the case of a menstruating woman, might be given something like a birth control pill, or in a menopausal women or perimenopausal women, some kind of hormone replacement therapy. And this is actually, in my opinion, causing more damage than it is helping people. Yes, a lot of times women will feel better in the short term, but end up feeling worse in the long term, and maybe even causing them significant harm long term when you consider some of the studies on hormone replacement therapy. So it's really about balance, and there's a number of things that you have to address first. Fundamental things like blood sugar balance, adrenal health, and gastrointestinal function if you have any chance of balancing out your hormones, whether or not you're on hormone replacement therapy. So a lot of women ask themselves, well, why do I feel this way, especially when my husband can eat a poor diet, not really exercise, and he doesn't seem to be too negatively affected? Well, that's really because a woman's physiology, especially when it comes to her hormones, is a very delicate and a very complex system. Now, a man's is not. So women, don't try to judge yourself or compare yourself to a man, because we're really very different creatures. The rise of estrogen-related conditions. There's a number of different things nowadays that are contributing to this, whether it's lifestyle, poor diet, lack of exercise, in combination with the fact that there's a number of different estrogen-related type compounds, like xenoestrogens, things found in chemicals and pesticides, and hormones that are found in our water and our meat supply, that are contributing to hormone and estrogen-related issues that we've really never seen before, and especially to this degree. For example, girls are hitting puberty as low as 10 years age and even younger in some cases. 10% of women are considered to have endometriosis. PMS is actually considered to be normal nowadays, and in previous generations, PMS was very uncommon. Uterine fibroids, about 25% of women from the age 35 to 50 have uterine fibroids. Breast cancer is up to 10% of women. Prostate issues in men are estrogen related. These are all at an all-time high, and it has to do with really an inability to manage estrogen inside and outside of our body. If you are menstruating, ask yourself the following questions. If you answer yes to these, or it's a strong yes, the more of them that you have, there's a really good chance that you have some hormonal imbalances that need to be addressed. Are you perimenopausal, or do you have an alternating menstrual cycle length? Do you have an extended menstrual cycle longer than 32 days or less than 24 days? Pain and cramping during periods? Scanty blood flow or heavy blood flow? Breast pain, swelling during menses? Pelvic pain during menses? Irritable and depressed during menses? Acne breakouts? Facial hair growth or hair loss and thinning? If you have any one of these things, again, and the degree to which you have them, then you might want to consider that you have hormonal issues. If you are menopausal, on the other hand, since menopause, have you ever had any uterine bleeding? Do you have hot flashes, mental fogginess, disinterest in sex, mood swings, depression, painful intercourse, shrinking breasts, facial hair growth, acne, or increased vaginal pain, dryness, or itching? Again, if you answered yes to these, or it's a strong yes, then there's a good indication that you have some kind of hormonal imbalance. Today, in both conventional and alternative medicine, practitioners are not effectively treating hormonal symptoms, and this includes bioidentical hormone use. This is my opinion, but there are some very firm underlying physiological systems that have to be working properly in order for your hormones to be balanced. And it's many times this is not being addressed. These issues are not being addressed with women, and I really feel proud, to be honest with you, that you're seeing this information, because knowing some of these things, A, you'll be able to have a better conversation with your doctor, and B, you'll have a better understanding of things that you need to do in order to have proper hormone balance. The underlying issues must be addressed to properly manage female hormones. Again, they're primarily blood sugar balance, adrenal function, and gastrointestinal function, including liver and gallbladder function. There are other things, but those three things have to be working properly for hormonal balance to take place in women. So let's look at some facts and statistics about studies. 2003 saw the sharpest decline in breast cancer rates in any one-year period. This was following the Women's Health Initiative, which I'll talk about in a second, showing that a combination of estrogen and progestin, like found in Premarin, increased the risk of breast cancer, strokes, and heart attacks. And what happened, there was a significant drop-off in women that were on Premarin, and interestingly, 2003, right after that study, showed the sharpest decline in breast cancer rates. In 1991, the New England Journal of Medicine showed a 50% increase in strokes among hormone replacement therapy users. And the Oxford study was a great one. It was used 1 million women, 25% of the population of England, 66% increase in breast cancer rate in women who were on synthetic HRT. There was also a 22% increase in mortality for those women. And then the Women's Health Initiative was a pretty funny study, if you ask me, that it was stopped 3 years early. It was supposed to be the study that absolutely irrefutably showed that Premarin didn't cause any problems, or hormone replacement therapy. But it was stopped 3 years early due to the concerns about increased rates of breast cancer and heart disease in women that were on this synthetic hormone replacement therapy versus a control group. So why all the estrogen problems? Well, first of all, lack of exercise, obesity. And the problem with obesity is that fat is no longer just considered to be along for the ride. It's actually an endocrine or hormone secreting substance. In fact, it's actually being classified as a gland itself because of all the things that it produces. Commercial meat contains many hormones in them nowadays. Commercial fruits and vegetables contain pesticides which have estrogenic effects in the body. Xenoestrogens are found in things like plastics. Stress, which I'll show you how that causes estrogen problems. Liver dysfunction, as I've talked about in the male hormone slide or video, that the liver clears hormones. And so if your liver's not functioning properly, and it's in all likelihood probably not due to the overload and the burden that is being placed on it nowadays with all the toxins that we have, you will not be able to convert or clear out your hormones effectively. There's also nutrient deficiencies, specifically things like magnesium and B vitamins are important for women to both be able to manufacture and clear out their hormones. And increased sugar and processed foods, of course, leads tremendously to estrogen problems. So here's a quick primer on female hormones. This is a very complex system, and what I hope to do here is just give you a real broad overview and understanding, again, so that you can have a better conversation with a doctor regarding this and have a better understanding yourself of what's going on. So in the hypothalamus, talks to the pituitary gland. The hypothalamus is found in your brain, and the pituitary secretes a number of things, as well as things like TSH for your thyroid. But as it pertains to female hormones, it produces luteinizing hormone and follicle stimulating hormone. Now, these both basically tell the ovaries to produce either estrogen or progesterone. And estrogen and progesterone then both have effects on numbers of tissues on the body, including uterus, ovaries, breast tissue, bone, brain, everything. But basically, I use the uterus as just any tissues in the body. Now, follicle stimulating hormone is responsible for estrogen production, and luteinizing hormone is responsible for progesterone production. So here's what happens during the course of a normal 28-day cycle in a woman. So at the beginning of the cycle, day 0, the pituitary secretes follicle stimulating hormone. And that has the effect of increasing estrogen levels for about half of the cycle until what's called mid-cycle. The first half is called the follicular phase. Now, when estrogen peaks around mid-cycle, that prompts the pituitary gland to have a quick burst of luteinizing hormone, which then tells the body to secrete progesterone, and estrogen will drop off. In fact, they both eventually drop off if pregnancy doesn't happen and the cycle continues. So the first half, as you can see with the blue line, is an estrogen dominant period, and the second half is a progesterone dominant period. Now, merely understanding this and looking at this slide and understanding what the pituitary secretes and what the ovaries secrete, you can see that over the course of 28 days, a lot can happen in terms of proper amounts of hormones being secreted or cleared, and can therefore create a number of different symptoms at any period along the course of the cycle or the course of the month that can lead to significant hormonal symptoms. So this is a very complex system where a lot can happen. So here's some of the shortcomings of modern testing to quickly go over, is that one blood draw does not assess an entire month of hormonal shifts. This is a woman's hormonal profile, a normal profile. If all you do is one blood draw, you don't look at the entire month. And I'll tell you what type of testing that I particularly prefer in our practice. The second problem is that oftentimes doctors will only draw what's considered to be a hormone that's bound to sex hormone binding globulin. Understand that if it's bound to sex hormone binding globulin, it's an inactive hormone and it can't have any effect on your body anyways. So really, ideally, when you do a blood draw, you want to look at free fraction hormones as well as bound to a protein hormone like sex hormone binding globulin. But if you only do one blood draw, then you don't get the picture of what's going on for your entire duration of your cycle. Serum-bound hormones are, again, unusable to cells. Only free fraction hormone can be used in cells. That's considered to be the active form. And here's a sample of a profile that we use, not particularly this lab, but this will give you an idea. Now, this is a normal estrogen curve as dictated by 17 salivary samples throughout the course of this 31-day cycle. And you can see that the dots there were the day that the woman gave the sample, and so therefore this chart can be fairly accurately determined based on what her estrogen levels were on those 17 different samples during the course of her cycle. Similarly, you can see that progesterone, the same thing happens. She gave 17 samples throughout the course of a 31-day cycle, so we can accurately map out what her particular cycle is. This is critical, and this is also, if it's salivary, it's free fraction hormone, so it's what the body is able to use. And here's an example of a fairly normal laboratory result. So let's take a quick example, or a couple of them, of what could be an abnormal result when you use these types of panels. So here you have estrogen's a little high at the beginning, a little bit low towards the middle, and then doesn't have the luteal phase peak that you would like to see towards the end. And progesterone, there's a slight peak at the beginning. Her mid-cycle peak or luteal phase peak happens a little bit too early, and it's not a very strong one. So this woman definitely will have hormonal symptoms just based on this profile. But here's a problem and a point that I want to make. If this woman went in to get her blood drawn from a doctor or her hormones assessed, if she went in on day 19 only, on that particular day her hormone was at normal levels. So she could be told that she's fine, that she has no problem with her hormones, that all the symptoms that she's having in her head, and then is sent home. Here's just another real quick example. This woman, in terms of her estrogen, would be considered to be estrogen dominant because she has such high levels of estrogen throughout the course of her cycle. And progesterone, as you can tell, really isn't doing what it's supposed to as well. There's a strong peak at the surge of it at the beginning. She has a double peak of progesterone at the end, and will most definitely have very significant hormonal symptoms throughout the course of her cycle. Again, if she went in on day 26, however, despite the fact that her hormones are completely unbalanced, she could be considered normal because on that particular day, both progesterone and estrogen were fairly normal. So let's cover some symptoms of estrogen deficiency. There's a number of these things, and I bring these all up for a point here. Estrogen deficiency, you might have hot flashes, night sweats, mental fogginess, insomnia, heart palpitations, a yeast infection, you're predisposed for that, depression, bone loss, dry skin, painful intercourse, low libido, vaginal dryness, and atrophy, which is a breakdown of the vaginal wall, headaches, memory lapse, and incontinence. Now compare those to estrogen excess. Breast swelling and tenderness, fibrocystic breasts, water retention, cravings for sweets, uterine fibroids, cystic ovaries, anxiety, nervousness, heavy and or irregular menses, low libido, fatigue, weight gain, mood swings, low thyroid symptoms, and headaches. Some of those were similar to the estrogen deficiencies, but that's not the only hormone that is playing a role in a female cycle. We also have to look at progesterone. Now many of these symptoms are similar to estrogen excess or too much estrogen. So if a woman's having these symptoms, is it too much estrogen? Is it not enough progesterone? A little bit of both. This is why you need good salivary hormone or free fraction hormone testing over the course of a month, multiple samples, in order to really determine what's going on with your hormone status. So symptoms can include swollen breasts, headaches, anxiety, irregular menses, cramping, infertility, spotting before your period, acne, weight gain, low libido, mood swings, depression, PMS, fuzzy thinking, and joint pain. Also, you can have progesterone excess. You might have drowsiness, mental depression, be predisposed for candida exacerbation, GI bloating, and also exacerbate symptoms of estrogen excess. So again, you cannot base a woman's hormones on symptoms alone. You really need to adequately assess those with laboratory testing. So then let's talk about balancing female hormones from the inside out. This is not about creams, lotions, or potions, but rather about balancing physiology. So number one, balancing blood sugar. I mentioned this before, but in women, increased insulin levels increases testosterone levels, and unfortunately, increased testosterone in a woman increases insulin, and then you get this really vicious cycle going on. The problem with increased testosterone in women is it leads to irregular periods, infertility, unexplained weight gain, fluid retention, fatigue, mood swings, acne beyond puberty, hair loss, and unwanted hair growth. It's also associated with estrogen proliferative cancers, increased cardiovascular disease in women. Estrogen happens to be cardioprotective. Testosterone increases cardiovascular disease in women. And abnormal lipid metabolism, as well as testosterone is the number one cause of polycystic ovarian syndrome, which is the number one cause of infertility. The second thing that you need to do if you want to balance your hormones is manage your stress, and specifically cortisol. Elevated cortisol as it relates to hormones will suppress pituitary function. Again, the pituitary is the master gland that tells all the rest of the hormone glands of what to do. And here's an example. This slide was used for the male hormone, but it will serve for here. So the pituitary, if it's dysfunctional by elevated cortisol levels, you'll have a decrease in production of FSH and LH, which will lead to a decreased production of estrogen and progesterone. And secondarily to that, in the case of chronically elevated stress, sex hormones are not important for women. And in fact, this pathway here is. So cholesterol is converted into cortisol to the exclusion of all the other sex hormones, and women specifically estrogens. So first of all, elevated cortisol suppresses pituitary gland function. It also will alter liver detoxification. This is because your liver detoxifies all of your hormones, including estrogen, testosterone, and cortisol. And if there's high levels of cortisol, then your liver has an excess burden of things that it needs to try to detoxify. And this has the result of increasing the amount of circulating estrogens you have because it's not being adequately cleared out of your body. Also, cortisol will alter gut function. Specifically, it can cause hypochlorhydria or low stomach acid. You will have a poor digestion of nutrients in this case, and you'll also be more predisposed for infections. An infection, of course, increases the stress level in your body. You can have an imbalance of good to bad bacteria, which I'll talk about in just a second, and also predispose yourself to something called leaky gut, which increases the permeability of your system to food, causing an immune system response, which leads to stress response and, of course, more cortisol. So here's a really, really very common and very nasty cycle that occurs in many, many women today. Increased insulin, again, increases testosterone in women. And increased testosterone has the effect of increasing circulating insulin levels by damaging insulin receptors on cells. Increased insulin is a stimulant, and therefore increased cortisol as a stress response, and increased cortisol raises blood sugar, which increases insulin. So you can see here that this cycle really feeds into itself and becomes really nasty unless something's done about it. So in terms of balancing females' hormones from the inside out, one, you must absolutely balance blood sugar. I talk a little bit about that in the diet, exercise, and attitude video. Managing stress is equally as important, getting an adrenal salivary panel done and all the different recommendations that are found there. You must optimize your gastrointestinal system, and here's a few things that you need to do. One is to make sure that your gut bacteria is balanced. I'll talk a little bit about this in the gastrointestinal video. You need to make sure that your liver is detoxifying properly, and again, that can be found in the toxicity and the toxicity video. Gallbladder function needs to be functioning properly. The reason why is because gallbladder produces something called bile, and bile attaches to hormones and clears it out of your body in your gastrointestinal system. In fact, basically what happens is you have circulating hormones, it gets detoxified by the liver, gets combined with bile, is brought into your large intestine, and then is evacuated via a bowel movement. That's what's supposed to happen. If you have a problem in any one of those things, if your liver's not detoxifying properly, if your gallbladder is not secreting adequate amounts of bile, or if you're in your colon or your large intestine, if you have an imbalance of good to bad bacteria, if you're constipated and it's staying in you longer than it should, all of these things will negatively impact female hormones. Again, these have to be working properly if you want to have hormone balance. And I talk about that there. Gut integrity and motility, making sure that things are strong, not having leaky gut, and motility moving along as they should be. So gut and liver dysfunction actually has a strong impact on female hormones as well. Intestinal dysbiosis, which again is an overgrowth of bad bacteria to the good bacteria ratio, can alter estrogen metabolites, leading to an overly estrogenic response in a female's body and then having estrogen dominance. Another way that this happens is the bad bacteria increase an enzyme called beta-glucuronidase, which then has the effect of reversing your liver detoxification. Basically, what your liver does to detoxify estrogens, the beta-glucuronidase enzyme undoes this and puts it back into your system, recirculates it in the body, and then again you have an estrogen dominant situation. So what to do? Balance insulin and blood sugar, manage stress, optimize gut and liver function, which means improving stomach acid, improving the detoxification abilities in your liver, making sure you have healthy bacteria. You must eat a whole food diet that has the proper nutrients for liver function, for estrogen metabolism, for estrogen production. And then lastly is to get tested. And again, I've already talked about it, but The salivary hormone panels are what we particularly like. It looks at free fraction hormones, ones not bound to sex hormone binding globulin, so you get to see what the actual hormone levels that can do anything in your body are doing. And it provides multiple samples over a monthly cycle to look at your particular hormone fluctuations, which in all likelihood probably differ from everybody else. Most women are unique in this way, and so what you really need to do is look for patterns that you have going on with your body. A good salivary hormone panel will include things like estradiol, progesterone, testosterone, DHEA, as well as the pituitary hormones like FSH and LH. And if you're menopausal, you really only need to give a single sample since you're no longer cycling. And this too will look at a number of those hormones. But in menopausal women, you need to look at adrenal function as well, because that's where the vast majority of your hormones are now being produced, since your ovaries are not working the same as they did. So coming soon is the Fat Is Not Your Fault Hormone Repair Kit. It's an in-depth book about male and female hormone physiology and function, where to get your own testing, the female salivary hormone panels I was mentioning, audio interpretation guide to walk you through your test, and what to do with diet, supplements, and things that you can do to help rebalance your female hormones. You can find it on fatisnotyourfault.com/hormones or hormonerepairkit.com. So thank you very much for watching this fourth video and the top 10 reasons why you aren't losing weight. I really appreciate your time, and I hope it's been helpful to you.